Hi everyone, thanks for watching, and if you're tuning in for the first time, my name's Marianne. I'm the owner and the counsellor at Marianne Hanson Counselling Service. I work with individuals and couples. The areas I specialise in are couples therapy, self-esteem, depression and stress. There's other areas as well, but those are the main ones. And what I want to talk about is, how do you know when it's right to end therapy? This has come up a lot for me because I also supervise trainee counsellors, and it comes up as a big issue. So if someone's working with someone for 30, 40 sessions and they feel like the person is just turning up for therapy, but the counsellor might feel that maybe therapy is coming to a natural end, but the client will still keep coming, but they don't have much to say, and it becomes a habit. There is no fixed rule about when therapy should end, but my feeling is that if the counsellor starts to feel that the client is just coming to just for a chat and it becomes like a habit, to me, you just explore that with your client. We would never say to a client that we feel that counselling should end. But I think if it's starting to feel awkward for both people, especially if you've worked together for a long time, or it can start to feel like more of a friendship, the professional boundary might disappear. So then you might start to say, well, this isn't feeling like therapy now, it's just feeling like a catch up and a chat. The other thing is, if the client is saying that there's no measurable results, they're coming every week but nothing's changing, they're not doing anything outside of the therapy, they're not feeling that they're getting the results, you can also explore that. I've had to do that a few times with a few of my clients. I've said, when we've done reviews and they have said nothing's changed from the minute they came to work with me, I've then questioned myself a little bit and said, okay, well, what am I doing wrong here? Because something should have changed if you've been working with me for 6 months. Then they might say, no, it's just that I still don't know. I'm still confused about what I want. And then if someone can't also put a goal together, what's the goal or the purpose of you being in therapy? It's really hard, not only for you to measure the outcomes, but it's also hard for you to then feel like you're actually getting something from it, because there's no goal, there's no purpose, you're just turning up. Now, it doesn't mean you can't just turn up to vent or to offload, but I think at some point counselling has to have an end. I'm not fearful of counselling sessions ending, because I think for me, the minute you start therapy as a counsellor, you're always working towards that day when your client will either say that I no longer need your support, or where you have a review and then you both decide, which is the best way mutually, that counselling is no longer needed. So yeah, there's the right time is when you feel it. I think people need to be courageous. The counsellor needs to be courageous in addressing if they feel that it's maybe time to end, explore that. And the client needs to feel confident and comfortable enough to say, well, I've been working with my counsellor for a year now, or however long, I'm ready for things to end. And not feel like you can't come back, and not feel like it's the end of the world because you've had this relationship for every week for many months. You can do it. But you just have to be confident enough to say, I think it's time for the counselling to end. So let me know what you guys think. How do you know if you've been a therapist? What do you do to discuss whether the counselling should end, or if you've been a client? Have you been in a situation where your counsellor has recommended that, or where you feel that it's time? I'd love to hear your thoughts. Thanks for watching. Bye.